Today we will discuss Patrick, a 78-year-old male who has worsening left-sided heart failure and chronic obstructive pulmonary disorder. He is very tired and coughs regularly and suffers from dyspnea. His legs are swollen from the knee down and he walks slowly. His past medical history includes long-term smoking from 20 to 60 years old and a myocardial infarction at age 68. Patrick's respiratory symptoms are influenced by multiple modifiable and non-modifiable risk and lifestyle factors, which exacerbate his chronic obstructive pulmonary disorder. The development and worsening of these symptoms can be primarily attributed to Patrick's long-term smoking. Inhaling tobacco smoke is the cause of 80–85% of COPD cases, and is often found in patients with a 10 to 20-year history of smoking. Patrick has a 40-year history of smoking, and although this has now ceased, major damage has already occurred. Tobacco smoke is shown to cause remodeling in various parts of the lungs, which is permanent structural changes due to inflammation. Furthermore, the regular cough Patrick experiences is due to increased mucus production in the respiratory tract. Inhaling tobacco smoke causes the airway diameter to shrink and makes clearing secretions from the tract more difficult through hyperplasia. Additionally, it causes alveoli to become overdistended, which means more air becomes trapped and the diaphragm is flatter, resulting in the patient's chest breathing, which is inadequate, causing dyspnea. Further, patients with COPD walk slower than those without the disorder due to the dyspnea experience. These patients seek to avoid activities such as walking faster or other physical activities, as this exacerbates the feeling of being out of breath. Patrick has noted that he is walking slower and experiencing leg swelling. Though smoking is not the only factor impacting Patrick's respiratory health, age also plays a role in the symptoms experience. With age, the lungs lose their elastic recoil and the chest wall stiffens. Residual volume increases, which affects the shape of the ribs and gas exchange in the alveoli. All these changes work within the body have an effect on the work of breathing and ventilation in general. Increased work of breathing makes the patient tired and lethargic, in addition to the decline in energy and exercise tolerance that age causes. This explains why Patrick is becoming more tired with the worsening of his condition and as he ages. Additionally, it's been shown that gender also plays a part, with more men developing COPD than women, although they do have a lower mortality rate. Finally, while being overweight is not a risk factor for developing respiratory symptoms and COPD, it is being linked to exacerbating the condition. Patrick has a BMI of 29.3, which makes highly overweight and a waist measurement of 104 centimeters, well above the healthy average of 94 centimeters, as described by the Heart Foundation. Being overweight is shown to increase breathing difficulties due to increased fat tissue on the chest and can lead to a reduction of pulmonary function. In addition to his respiratory issues, it is noted that Patrick is tachycardic at a rate of 155 beats per minute, well above the average for a healthy adult of his age, which should be between 60 and 100 beats. There are many factors that contribute to this symptom he is experiencing, again including his long history of smoking tobacco. It has been proven that smoking causes increased heart rate as it is a vasoconstrictor, meaning veins and arteries are narrowed as seen in the image on the left. Therefore, the heart has to pump harder and faster to provide adequate blood flow to the body. This is likely to be a contributing factor to the myocardial infarction he suffered in his left coronary artery. Furthermore, being overweight is a major factor to consider when examining the causes of tachycardia. Patrick's BMI, which we have previously discussed, is on the cusp of being obese, meaning there is an overabundance of fatty tissue and deposits. Patients who are overweight are often seen to have atherosclerosis, which means arteries are clogged by fatty material which builds up over time, blocking blood flow as seen in the image on the right, thus increasing heart rate and increasing the risk of MI. The exacerbation of Patrick's COPD is also likely to have an effect on his heart rate. The symptoms of COPD, including dyspnea, are shown to be related to tachycardia. This is an indicator of worsening of this disease. Finally, Patrick has been diagnosed with left-sided heart failure, which means that the left ventricle is gradually weakened, preventing the heart from pumping oxygen-rich blood to the rest of the body. To compensate for this decline in cardiac output, the heart beats faster and harder to prevent blood from pooling in the lungs. Therefore, it can be seen that Patrick possesses many risk factors for a higher heart rate. While COPD and left-sided heart failure develop independently, their causes are similar and they are known to influence each other when they coexist in a patient like Patrick. COPD is a progressive and irreversible disease encompassing conditions such as chronic bronchitis and emphysema, which develop over time primarily due to smoking, defined by limitation of airflow in the alveoli and inflammation of airways as seen in the left image. However, left-sided heart failure is a name given to the process of the weakening of the left side of the heart. It causes the left ventricle to not pump efficiently, preventing the body from receiving sufficient oxygen-rich blood as seen in the image on the right. It is caused primarily by hypertension and MI, which both result from narrowed blood vessels or coronary artery disease. These conditions in Patrick can also be attributed to smoking, which, as we have previously discussed, are vasoconstrictor. Additionally, this would be caused by the high levels of low-density lipoprotein and triglycerides in the blood, combined with low levels of high-density lipoprotein, also referred to as hypercholesterolemia, as it creates fatty buildup in the artery walls. Another contributing factor would be Patrick's increased sodium levels, which increases fluid retention. These factors would have combined to cause a blockage and thus Patrick's MI, leading to left-sided heart failure. However, while developing independently, the conditions are known to worsen each other. COPD exacerbates the effects of heart failure as it causes low oxygen content in the blood, straining the heart, and further decreasing the ability for it to provide oxygen-rich blood to the body. The heart will then work harder to compensate for this and thus gradually weaken the left ventricle further. Heart failure also worsens the effects of COPD by making breathing even more difficult, as when the left ventricle is not able to pump efficiently, the blood builds up in the lungs and puts pressure on them. Further, the heart works harder to pump this blood through the heart, increases the likelihood of pulmonary edema and pulmonary hypertension, which also increases the effects of COPD. Patrick is now at risk of developing right-sided heart failure due to his prior conditions, left-sided heart failure and COPD. Left-sided heart failure can result in right-sided heart failure as there is an increase in left ventricular filling, which is reflected back into the pulmonary circulation. As the pressure in the pulmonary circulation rises, the resistance to right ventricular emptying increases. The right ventricle is poorly prepared to compensate for the increased afterload and dilates and fails. When this happens, pressure rises in the systemic venous circulation, resulting in peripheral edema, which Patrick has also developed. Patrick's COPD, in conjunction with his left-sided heart failure, increases his risk of developing right-sided heart failure as there is an increase in right ventricular afterload. Furthermore, COPD can influence the heart's right ventricle through pulmonary hypertension, which is when the blood pressure inside the arteries rises in response to abnormally low oxygen levels in the vessels as a result of COPD. This excess strain from pulmonary hypertension on the right ventricle can result in right-sided heart failure. Additionally, Patrick has also stated that his lower legs have become very swollen and puffy. This is a major warning sign of right-sided heart failure, as when the right ventricle begins to weaken, fluid builds up in the feet and lower legs. Patrick's low hemoglobin levels indicate that he is anemic. As a result of the low level of red blood cells, it deprives the body of adequate oxygen. When a person is anemic, the heart is required to work harder to pump the quantity of blood which is needed to get adequate oxygen around their body. Low hemoglobin levels can impact Patrick's neurological function and result in cognitive impairments. Patrick's sodium levels show these high levels of sodium as they are above 145 millimoles. This can be as a result of not drinking enough fluids, fluid loss, kidney dysfunction, and diuretics. Correction of this must occur slowly to prevent the rapid fluid movement into the brain and cerebral edema, as changes can lead to seizures and confusion. His potassium results are high at 5.2 millimole, which indicate that he is mildly hyperkalemic. A high level of potassium in the blood can result in changes in heart rhythm. Elevated levels can impact neuron and loss of function, affects the resting membrane of an action potential, which is what the body requires for cell functioning and control of the body. The results show Patrick has high low-density lipoproteins and low high-density lipoproteins, indicating lipidemia. When LDL levels are high, they start to form a plaque substance on the walls of the arteries and causes the vessels to narrow, which can eventually block them, while HDL assists in removing excess cholesterol from the bloodstream and cells in the body. As cholesterol builds up inside the artery walls and forms a sticky plaque, the buildup can eventually harden the arteries. The arteries then narrow, which limits the blood flow. High cholesterol impacts the neurological function as it increases the risk of stroke through blood clots that may be formed. The results of triglycerides show that Patrick has high triglyceride levels, indicating hypertriglyceridemia. This can impact neurological function as there is an increased risk of stroke. While Patrick has had extensive blood testing as in the results just discussed, there is another substance which is likely to have an abnormal result. The brain natriuretic peptide, or BNP blood test, is a diagnostic tool used for heart failure. This substance is a neurohormone secreted by the heart, which is an indicator of heart failure. It is prompted by ventricular wall stretching due to volume overload, as heart failure prevents the blood from being pumped out efficiently. Performing this test on Patrick will enable us to see the worsening of his heart failure and develop a baseline to gauge if further treatment of his heart failure is stabilizing his condition. The Medical Services Advisory Committee states that heart failure is unlikely in patients who return a result of under 100 nanograms per millimeter. Therefore, Patrick's results are likely to be much higher than this as he's been diagnosed with heart failure and appears to be worsening.